All right, so coming closer to the current time now, well, Dr. Nick Kollerstrom in his book actually drew out a timeline of the whole thing. I can put that on the screen. So I'll quickly run through it.
Okay.
So January 20, just jump in with comments, Andrew. So January 2018, so this is a whole year, no, it's 2 years before the alleged pandemic. China's first maximum security virology lab opens in Wuhan. I think they've got 2 level 4 security labs at the moment in China. I think there's something like 50 worldwide. I've got the number. November 2018, Pirbright Institute Woking issue patent for coronavirus. May 2019, swine fever hits China pig farms, 400 million die. August the 13th, 2019, Operation Crimson Contagion held in Washington, D.C. So this is another one of these mock-up tabletop exercises, which obviously a whole year earlier. September the 12th, 2019, Global Vaccination Summit held in Brussels, September the 19th, 2019. So this is the year before our alleged pandemic. ID 2020 Summit held in New York to promote digital identity. This is something that we're going to come on to. October the 1st, 2019, most recent common ancestor claimed for the RV19 RNA sequence in Wuhan.
CV19 RNA sequence.
Right. So this is the start of the alleged outbreak. Well,
a bit before, just a bit before, yeah.
Right, yeah. So October the 18th to the 27th, I didn't know this until I read Nick's book, Military World Games held in Wuhan, China.
Yeah, and this is something that Anne Carey wrote about as well. I read about that back in, I think, February when she'd written that up.
Right, we'll talk about Wuhan a bit later and mention that. So then on October the 18th, 2019, Event 201 held at John Hopkins University, so which is that New York or Washington?
I think it's Washington, yeah.
The World Bank and the IMF are both in Washington, D.C.
Yeah.
So it seems to me that Washington, D.C. is, at least in part, one of the main places where this is being cooked up.
Yeah.
I think there may be other places as well.
Yeah, I think so. Yeah, and then of course it's that I think the Event 201 is the one that most people have heard about, that I've looked into. I've spoken about that a lot when I've been on the streets and stuff. And Bill and Melinda Gates Foundation heavily funded that event and setting up. And the key thing was that it involved a coronavirus, specifically a coronavirus that they named in that. Whereas the other ones, I'm not sure about the earlier ones, whether it was just some more generic thing.
Yeah, and it almost seems too obvious. The Event 201.
It does. And in fact, if you watch that Plandemic 2 Indoctrination, the Mickey, his film that's on the, he actually, what he does is very nicely, is he puts the simulated scenario from the Event 201, from a simulated news broadcast, and then he puts that side by side with a real news broadcast from, 4 or 5 months later, and it's very effective, showing you exactly how blatant, as you said, it's very, very blatant.
Right. I think the purpose, or one of the purposes of Event 201 was to get the recommendations to governments to say, well, if and when it happens, this is what we'd like you to do, or this is what you must do. These are the guidelines, and they needed some sort of public exercise in order to launch those.
And there's certainly, I think, a mindset which says, they were really clever predicting all this. They had it all worked out. So we better follow their advice because they've clearly, looked into this and they know stuff, rather than people looking at it to say, hang on, they've been planning a bank robbery and they've now robbed that bank. Yeah. We should be arresting those people. Yeah. For some reason they don't see that. Yeah. They just think, these are the real experts. We must follow what they say.
And it's 6 weeks from Event 201 to when the alleged pandemic starts.
First case, yeah.
Right. So if you don't know what we're talking about with Event 201, there's some videos in my Scamdemic section. Just go and watch those videos.
They're on YouTube as well, and they won't take those down, of course. Because there's nothing wrong with those, is there?
Yeah. So October the 31st, 2019, the first large-scale 5G network engineering program turned on in Wuhan. So we'll come on to the claims about 5G and its effects on health. November 2019, CAPI pledges $700 million for the development of RNA, DNA vaccines. December the 2nd, 2019, two-day Global Vaccine Safety Summit in Geneva. December 31st, China reports first COVID-19 infection and alerts the World Health Organization. January the 12th, China publishes complete genome of the virus. Now that puzzles me.
Yeah, indeed.
I did see Del Bigtree interviewing a geneticist about this who downloaded a copy of the full genome, right? And he was concluding that there's a part of it which cannot have occurred naturally.
That's where we got onto the man-made thing, isn't it? They said exactly the same with the swine flu virus, I think, or they said that it must have been either modified or whatever, by genetic engineering.
So would you question whether they've sequenced?
Well, I think to quote Andrew Kaufman, he said that if you go and look at the original papers to find out where they actually got these samples from, and what they actually sampled and stuff, and what they did with the samples, it's very vague. They don't give a clear description of where these sequences originally came from. If you go and read the original papers, so it seems that this whole idea of actually identifying an individual virus certainly isn't cut and dried at all.
As you said to me before the interview, if it was simple to sequence a virus, get the DNA sequence, then every country in the world would have done it.
Yes.
And should get the same sequence.
Yes.
But it seems to be only China that's done it.
Originally,
and then given a copy to everyone else.
And nobody's bothered. And this is the thing, let's just change tack just for a couple of seconds, where people will say, oh, well, you did those cold fusion experiments. That was all bogus because nobody reproduced the results, So it must be bogus because nobody's able to reproduce the work of Pons and Fleischmann, and that is actually untrue anyway. But switch that to the virus thing. We've talked about how we've written to Public Health England, said, where's your own British, UK evidence of isolation of the coronavirus from a corpse? They haven't got any. And they haven't bothered to reproduce, what if the German team or what if the Chinese team made a mistake and this virus is actually slightly different to what they claim it is? Why haven't we done our own independent verification? Which would be the same as, for example, verifying a cold fusion experiment, wouldn't it? Same scientifically, but they haven't done it.
Yeah. And according to them, they've got lots of dead bodies with the coronavirus in it.
Apparently. So they should have plenty to choose from, shouldn't they?
Yeah. But they haven't. Okay. January the 20th, Netflix releases Pandemic, How to Prevent an Outbreak. And, Netflix is just a propaganda outfit, in my opinion. January the 23rd, lockdown and quarantine of the entire city of Wuhan. 23rd of January, CEPI announces initiation of programs to develop COVID-19 vaccine. So in January, they're talking about vaccines. And then on the 5th of March, the first alleged British COVID death. 17th of March, Professor Ferguson at Imperial College predicts 500,000 UK COVID deaths. And then on the 17th of March, the French go into lockdown. The 19th of March, status of COVID-19 is no longer considered to be a high consequence infectious disease. I remember there's a lot of people were passing this around at the time.
Yeah, that's right.
So
I was too.
France has gone into lockdown, and then on 2 days later, Britain has not gone into lockdown yet the government, on their own website, downgraded the status of it.
And in fact, we found out, that courtesy of John Asprey, where that came from, didn't we? And this is something I've spoken about many times in some of the street speeches I've done over the last few months. And John Asprey got the letter from the ADCP, which is the ACDP, the Advisory Committee on Dangerous Pathogens, headed up by Tom Evans, and it was actually his group that said to the Public Health England on 13th of March, this isn't a high consequence. They basically said, well, this is just a regular flu. That wasn't their words. Those weren't their words. But I think that's essentially what they were saying. This is not going to be that much different from a seasonal flu. And that ended up on the government website 6 days later.
Right.
So
do you think that's them covering their own arses?
A little bit. A little bit.
In case, in a year's time, it all goes wrong.
I think there's probably some of that.
And the government just hope no one sees that on their website.
Yeah, because they'd already made a decision, And we'll talk about this report, I think, that I did eventually, but I think it's important to mention at that point, now we're on this date of the 19th of March, that it was only 4 days later that Matthew Hancock said before Parliament, this is really terrible, we've got to hit with this, with everything we've got, when he'd been told by his advisory committee of experts that this was not, not something which was serious, not in the way that he was claiming. And then Hancock actually stated that the coronavirus bill, had been in development for 3 months. He actually stated that. That's in the Hansard record.
Yeah.
So.
And then on the 23rd of March, Britain goes into lockdown. Yep. I just want to make a point here about the date, because I think that's the equinox date.
Oh yeah, the spring equinox.
I think that's the spring equinox.
The other thing, there was another thing about the 23rd of March as well. That was the Enabling Act in Germany, the 1933. That was the 23rd of March as well.
Right, because if you go forward 6 months after the British lockdown, 23rd of March to the 22nd of December, Boris Johnson says, this is in Parliament, Mr. Speaker.
22nd of October.
22nd of September. Yeah. Boris Johnson says, Mr. Speaker, we will spare no effort in developing vaccines, treatments and new forms of mass testing, but unless we palpably make progress, we should assume that the restrictions I have announced will remain in place for perhaps 6 months. And he said that on the autumn equinox.
Right.
And he mentions the word 6 months.
Right.
So I've said it's as if the lockdowns are being planned around the pagan calendar or the solar calendar. Mm-hmm. There seems to be reference to it.
I've also pointed out that we've had a number of announcements on the 11th of the month, like the pandemic was announced on the 11th of March by WHO, and there's been various announcements on the 11th of the month as well. Yeah,
which is, we know that 22 is a sort of an occult number from the Manchester bombings, and 2 times 11 is 22, 9/11. They do seem to insert these things into their
sometimes, yeah.
All right. So if anyone's got any more information on that, let us know. We'll just mention that there was a few articles, people suggesting that maybe the virus had leaked from this lab at Wuhan, because there's a level 4 lab which does allegedly use dangerous material, viruses.
And they're doing this gain of function research, which is where I think they're meant to fiddle with the virus so that it does different things or has different effects on people.
Right. So the official story is that it came from a seafood market, but we just so happen to have a level 4 lab. Well, I've got a map here. It's not that close to where the lab is. We'll have a look at the map later. But to me, why would, if something's just occurring randomly because someone ate a bat or something like that, it's random, it's going to turn up in a random place, isn't it? Why would it turn up next to a lab? It suggests to me that someone's deliberately chosen all of these things just to muddy the waters. Is it from the market? Is it from a lab? Is it from a vaccine?
It's a bit like the story with the 9/11 planes, where these hijackers, they were trained at this airport, or the hijackers afterwards were alive, or the hijackers, one came from Saudi Arabia, the rest came from this, that, and the rest. Well, actually, there weren't any hijackers.
Yeah.
It's the same sort of thing with the virus, isn't it?
It came from a lab. It came from a vaccine. It came from a bat. Well, actually, there wasn't. There wasn't a virus.
The virus is in the testing kits, so you're getting the virus when you get swabbed, and all this that's been said.
Yeah, the argument itself perpetuates a false assumption, perhaps.
Right.
Yeah. All right. Now, just tell us about epidemiology, the flawed science of epidemiology, Andrew, and Professor Ian Ferguson. What do you know about him?
Neil Ferguson. Yeah. Well, I mean,
it's not Ian Ferguson.
No, it's Neil Ferguson. Is the guy who came up with the model.
Oh, I've got that wrong. Neil Ferguson.
Yeah.
Right. Yeah.
So epidemiology, my understanding is the study of how diseases spread in populations.
Yeah.
And so it's not...
I'll just interrupt you there, Andrew. What we said at the beginning of this interview, assuming it's true, right, the whole of epidemiology is based on a flawed assumption.
It is, yeah.
Right,
yeah.
But can continue.
So, I mean, it's not so much a science that involves specific study of biological mechanisms, I don't think. I guess that comes into it a bit. But it's more a statistical science of... how populations get affected by diseases. And so this Neil Ferguson guy, he's why people actually listen to him, is a bit of a mystery because he was involved in the foot and mouth, predictions as well back, I think, in year 2000.
Yeah, Ferguson has used mathematical modelling to provide data on several disease outbreaks, including the 2001 United Kingdom foot and mouth outbreak, the swine flu outbreak in 2009 in the UK, the 2012 Middle East respiratory syndrome coronavirus outbreak, and the Ebola epidemic in West Africa 2016. His work has also included research on mosquito-borne diseases, including Zika fever, yellow fever, dengue fever, and malaria.
Yeah, and I mean, he said in 2002 that in the UK, 50,000 people might die from the BSE, the mad cow disease, and I think it was they could only put down about 177 people. Apparently, we're all going to die from that mad cow disease, weren't we? At some point, according to what was put out then. Same as with AIDS, it was very similar to AIDS, but of course none of this has come true. Perhaps very much because, as we've said, the causative agents of these diseases are not what they claim. It's something else, or it's a combination of other things, nothing to do with whatever they're claiming at the time. Bird flu predicted 200 million deaths 2005, as you've got here. 65,000 deaths for the swine flu in 2009, and yet 457 or around 474, I think, maybe whatever the figure was, died. The figures are going to vary slightly. So, who is this guy? Why is he even being listened to when he's clearly been wrong so many times before?
And let's just try and summarise what it is that he does. He'll get a statistic, which, let's just say we're sitting in this room together. There's a 0.8% or 80% chance that I'm going to pass something on to you if I sit with you for a certain period of time. And then he'll model the population.
That's right.
And just write a computer program which simulates that based on the R number.
The R numbers and the spread of the population, the age demographics, the how many people live in cities or live in rural areas.
How many people you will speak to in a day.
Right.
And profile all that, and he'll put that all into a computer model. And this is how many people are going to catch it.
That's right. And I mean, again, like all modelling, it has its uses, but how accurate is it, Clearly, we've seen in the past that the model was not accurate at all. Yeah. And again, we've seen that now it's not being accurate.
And apparently he wrote the main programme 13 years ago in C, which you and I are both very familiar with. Yeah. And his code was completely undocumented, apparently.
Yeah.
Now, that's a criminal offence if you're a software engineer, folks. I used to pride myself on documented on program comments, often putting witticisms in there as well. But you're supposed to write a description of what the program's doing for anyone who's not quite up to speed on the language or what have you. But undocumented code.
And in fact, he made his code public eventually, and there was a bit of a hoo-ha about that because Imperial College were getting a rap because people wanted to see this code on which the whole country had been shut down based on some of the elements that this code had. Some of the predictions this code had generated, so rightfully so, people wanted to see it. And there's an article on Lockdown Skeptics about how they criticised this code and took it apart and showed that it was bug-ridden, and just not fit for purpose.
Right.
And I think it's, one of the things I said as well is that the story came out about Ferguson skipping the lockdown and going to see his lover, his mistress, who has some interesting connections, actually, when you look into that story. And people say, "Oh, what a naughty boy he was!" Doing his own thing and not as he said. He shouldn't be going out anywhere. But again, the other thing is that Ferguson probably knows that the virus isn't a real threat. There is no threat from a virus. So that was probably one of the reasons why he didn't bother with the lockdown. Not just because he was being a naughty boy, it's because he knew it wasn't a threat. And I think, though the press would criticise Ferguson. Obviously, I think he resigned from the SAGE group. We haven't talked about SAGE yet. But they didn't point out that maybe this virus wasn't actually a threat, and that was one of the reasons why,
all these people are just flunkies. They're just used by those who are hiding behind, the various NGOs and what have you. It would be great if we could get to the real string pullers somehow as to challenge them as to what's going on.
Yes.
It is a bit like the Wizard of Oz, I think.
It is.
Now, I said at the beginning that you're wasting your time if all you are doing is protesting on social media about the scam. Why is that? Well, it's because the way that social media has been set up now, it contains your viewpoint. So predominantly you will only be heard by people who already agree with you. And if you go outside and you ask someone who follows the official line and ask them what they've seen, they won't have seen anything. They won't have seen alternative opinions. So what social media is doing is it's keeping people in kind of a bubble so that they're in an echo chamber effectively, right? So this is why you need to get off your arse and get into the outside world and contact people directly. I've contacted my MP several times to complain at him. I contacted the Chief Constable of South Wales. I got an interesting reply from the police. I got a letter, and they didn't disagree with anything that I said. They said, thank you for sending me this very interesting information, but we can't identify anyone who we can arrest. That's what they said. So they weren't disagreeing with me when I was claiming that it's criminal acts that have been carried out with the scamdemic, and they didn't try and persuade me not to comply with any of the measures. So that's an example of two direct things that I've done. I'm also wanting to organise other events as well outside of the house. And I think that's the key thing. You've got to get out. You've got to, if you've got kids in school, go and see the headmaster. Go and tell them that you're not happy with it. Go and tell them that you're not happy with your child wearing a mask or sitting in a certain way, whatever rules that they've got. Wherever you work, go and see your boss. Tell them you're not happy. Tell anyone you can that you're not happy and that you don't want to comply with this nonsense. So you have to do things outside of your own house if you're going to get active, if you're going to make a difference, right? Now, one thing I've been doing, I've not worn a mask. I've been wearing one of these, Andrew. It just says that I'm exempt. You can get those online if you don't want to wear a mask, but you haven't even been wearing one of these.
No, I haven't worn a lanyard or anything or an exemption, because I just say I'm exempt. If anybody challenges me, I just walk into the shop. So I'm exempt, and they're not allowed to ask you. So, unless somebody is giving you medical treatment, your doctor or a health professional that's actually treating you for something, and they have a need to know about your medical history or medical condition, you don't have to tell them anything. So you just say I'm exempt, and you're not allowed to challenge it, and they can't do anything. And this idea of getting in the face of people, definitely talking to people at the schools or where you work. Again, for me, I work at home, so it's not an issue. I don't even come into contact with people physically when I work, so I don't have those issues. If you're being forced to wear a mask in your job, you should show them that there are medical studies which show that wearing masks for a period of time is unhealthy, and there's several of these have come out recently, and the masks have no effect anyway, and the government said that up until the end of April, I think it was. They were saying masks don't work. They don't have enough of an effect to actually bother with. But going back to talking to the school, I was contacted by a person, and they had kids at a primary school, and they said, well, can I write to the headmaster on my behalf and tell them that, a bit about the scam and why it's a scam and stuff, because they might listen to you because, you've got a bit more knowledge than I have. And so I wrote to this head teacher, and he did write back saying, oh yes, well, thank you for your message, but I'm just interested in the safety of the school and the safety of my staff and pupils and some stuff like that. He didn't engage with the evidence at all. And then sometime after that, this chap that had written to me, he'd been giving out leaflets and giving out copies of this report that I've written, which I'll mention. So I've written this report about the scam and the fraud and the crimes committed. And you can get free copies of that from me. And he had sent this to his head teacher and to various other parents. And this head teacher contacted me out of the blue a few weeks later and said, oh, is this some campaign of yours? It's my school, and if so, it's got to stop. I say, no, it's not a campaign of mine at all. It was one of your children, parent of one of your children at your school. He contacted me and asked me for leaflets and reports, and I sent them to him. It's him that's been giving them out, so you need to talk to him, not me. I haven't organised this, but I agree with him. And I sent him this link to the Cardinal Vigano letter about the takeover of the world.
This was a Catholic school.
Yeah, it's a Catholic school. Because I thought, well, if this is a Catholic cardinal, he's very articulate, maybe this will take an interest and look at it from this angle. Apparently not. These, even when you put in front of them a Catholic cardinal's sort of study of the evidence, they won't. They just rather go with the government.
And he wrote to Donald Trump, didn't he?
He did. The Cardinal did, and Donald Trump retweeted this message, which was very interesting that he would do that. But going back to this report, so other things in non-social media activism is I did this report. It's called Evidence of Fraud, Medical Malpractice and Acts of Domestic Terrorism and Breaches of Human Rights. And I sent that to police, I've sent it to the Care Quality Commission, I've sent it to various places, and I've probably sent it to about 300 or 400 people now. And I also attached a petition to this, which I also put on my own website. I didn't use one of these petition sites because some of those are actually controlled as well. And I've got about 2,000 people, one of whom is a doctor of pathology from Birmingham University, who basically said, yep, I agree with your stamps on this, I'm willing to put my name to this. So that makes it a bit more impactful, I hope. It's my intention that 2,000 people agree with me. It hasn't cost me anything, I haven't set up a legal case or anything like that. What I'm saying is to these bodies, councils, police, head teachers, you need to investigate this. I don't have any responsibility for this. I'm just a, tutor for a university. I don't have any status or responsibility other than to the students that I tutor and assessing their work. You do,
yeah.
And you should be looking into this. You should be, asking why these things are going on.
Well. So people in middle management type positions who have people working for them, so head teachers, chief constables, people who are the enforcers of these rules, right? Why aren't they asking questions of their superiors? These are the people who I think have let us down.
Yeah, I agree.
People who have got some responsibility in their job. They need to be banging their fist on the table, demanding why they're having to do this from their bosses. Yeah. And it's just not happening.
It's not happening.
They're hiding under the blanket. It should be of no consequence to express your opinion to whatever company or whatever organisation you work for, and do that vehemently every day. I don't believe it, it's a scam. I don't believe it, it's a scam. I'm not complying. Why are you complying?
Yeah.
That's what people need to be doing with the organisations that they work in and the places where they go and the shops that they shop in. I don't want to comply with it because it's a scam.
That's it. And I think it's going to come to a point where you have to challenge it. And if they threaten you with the sack or whatever, or termination of employment, you say, well, I'm going to take you to court because we have the evidence which proves that these measures are not enforceable. They are not enforceable because the science and stuff on which they're based, a little of which we've covered already, is not provable. And they've lied about it as well. Ferguson has lied, Matthew Hancock has lied, and all of this. And we can prove all of that. So, once you understand that and know that, you should draw strength from that. And that can give you the strength to actually not comply and say you can't enforce this.
But you've said that the only thing that stops them doing that is that they're worried about losing their job.
Right.
But a lot of them are going to lose their job anyway if this economic rape continues.
Yeah, this is it.
They're not going to have a job.
Yeah.
Too late to complain then.
Exactly, and what's going to come after? Is everyone going to be living on universal credit? I mean, maybe we'll get onto that a bit later, but and I had this other example where a chap I know had sent me an information leaflet about the current sort of status of the vaccines. There's several different ones. There's a Pfizer one and the Moderna one, and there's one or two others. And got a very good leaflet from somebody, and I stuck it on my website, and then I was contacted actually yesterday. And this person said, oh, can you change the file name on that leaflet because it's got some initials in it which identify the person? And I says, yeah, sure, no problem. But I was discussing this with Richard just now, and he was pointing out that obviously means they're so concerned about being identified for speaking out, because they apparently work in the medical profession. This person who did this leaflet, I don't know their name, I don't know what their job is, but clearly they were concerned enough to actually want to contact me and have this changed on my website. Well, anyway, again, which I can understand, but that means then that they're afraid of expressing their knowledge, not just their opinion, but their knowledge, in fact, in their job, and this, of course, is what's happening all over the place.
So stop hiding in the house, stop hiding your name, get out of your house, knock on doors, make a nuisance of yourself, send letters to people of responsibility, tell them that you're not happy, tell them that you don't want to comply because you think it's a load of nonsense.
Yeah, I mean, you can at least write to your local council, you generally don't get written to that much, as well as your MP. I mean, MPs are a lost cause, really, but you need to be writing to these people.
I think one problem with the issue is that the nub of it is actually invisible to everyone, right? Nobody can physically see an alleged virus, nor can an electron microscope, apparently. Even if we had an electron microscope, we'd be struggling. So no one really knows what's going on an atomic level. No one can see what's going on an atomic level. This whole thing, if it's real, which I don't believe is invisible to us. Now that very fact protects the truth.
Yes.
Because you can't see it yourself with your own eyes, you can't get direct evidence of the scam, right? Or if it's happening, right? You can't see it. So you don't feel fully confident in arguing against it because it's invisible. That's a protective wrapper around the truth. And the other wrapper around the truth is that you're not a medical doctor, Andrew. What the hell are you doing on this video? Why are you writing that? You don't know about medicine. Where's your degree? Oh, you're a computer scientist, are you?
That's right.
Oh, well, come on, I can ignore that.
That's it. And I've had exactly that criticism said to me more than once, actually, in this. And it's the same thing. And then you can obviously go to the fact of people like Bill Gates, as you did on your previous programme, getting 17 minutes on BBC. He's not a health professional. He's not got any medical degrees. But people will accept, apparently, what he has to say about the matter.
So don't be concerned that you're not a medical professional, you haven't got a medicine degree, and don't be concerned that you can't actually see what's going on with your own eyes, because they're just helping this whole scam to live on.
Yeah.
All right?
Yeah.
Now, there are a number of people in the mainstream medicine who, although they don't go along with this idea that a virus isn't responsible for disease, they're completely against all of these measures. And one of them is Professor John A. Lee. He's a retired professor of pathology and former NHS consultant, and he appeared on Irish TV. I'll just quote him. He said, "There is simply no excuse for imprisoning the population. It's simply not fair to young people. It's not fair to anyone under the age of 70, and it's not fair to people over the age of 70, because it removes the things that make life worth living. There is simply no justification for it in the science or the medicine. It's quite clear that the infection fatality rate is comparable with flu. This is a societal experiment. It's the wrong thing to do." So that's a mainstream professor of pathology saying that. There's a number of other people who are, let's say, they're on the fringes of mainstream. Carhill's one of them.
Yeah, Dolores Carhill, and then we've got other people like Dr. Mike Yeadon, who's a former Pfizer. He was in charge of a division of Pfizer, and so a lot of them are saying, that even if you go along with this viral infection model, the lockdowns are still, don't work, and they're just causing so much damage. But of course, people would say, well, they're just controlled opposition because they're not getting to the underlying story of there actually being no viral infection. That is all just an illusion, and people are mistaking, the effects and the causes,
Yeah.
So
people like Carhill, they will go into all of the statistics and the figures, and they'll actually believe them.
Yes.
But we'll come on to those statistics in a moment. But you've got people like Dr. Tom Cowan, Dr. Andrew Kaufman. Dr. Andrew Kaufman talks about exosomes. So he will say that when your body is diseased, it's processing that disease, and the cells need to get rid of unwanted waste material. and that waste material is microscopic and looks like a virus.
Yeah, if you put it under an electron microscope, it looks very similar.
Right, and these are called exosomes, which are produced as a consequence of the disease. So they've got the cart before the horse on this issue, that diseases cause virus DNA, which is harmless, even if it gets into someone else's body, not the other way around. It's not the virus that causes the disease. You get a disease and there are waste particles which are identified as viruses. So it's a bit like the old fire brigade argument. My friend believes that the fire brigades start all fires because they're always there when there's a fire at someone's house. Yeah, we know that's not the case.
Yeah, and you only know that because you get to know when the fire starts, and you know when the actual help arrives, don't you? So yeah.
Right. Diseases that mainstream say are caused by viruses, there's a number of alternative explanations as to how they may really be caused.
Yes.
So environmental factors, health factors, psychological factors.
Yes, yes.
So I mentioned earlier the comparison of HIV and AIDS and SARS-CoV-2 and COVID-19. You were contacted by an immunologist on that very issue, Andrew. Do you want to tell us about that?
Well, I mean, she was pointing out, you know, and I sort of knew this already, but she made it a lot clearer. Again, the conflation of the virus and the disease. So they then, you know, she said, well, look, you know, this SARS-CoV-2 allegedly causes the disease, as you said, just in a way, HIV allegedly causes AIDS. But in both cases, we don't actually have scientific evidence that that's true. It's just become, you know, oh, well, you know, we think it's probably true, and then from that, enough people have said we think it's probably true enough times to it becoming the truth, and an unchallengeable truth certainly now. So, you know, this then leads you on to the idea that if you test for the virus, you're testing for the disease. So if you get a positive test for the virus, it means you've got the disease, and therefore you are infectious, and therefore you are a risk. So that is that is why she was making a point of distinguishing between the virus and the disease, because if you test for the virus, then you know you can then, and you get a positive result, you can then introduce all these measures based on the positive result only, nothing to do with the presence of the disease.
And i.e. they have no symptoms and may never get symptoms, and the virus might not even cause the disease in anyone.
Yeah, in anyone.
You
can still bang them up.
Yeah, you can still, and I don't think there's any precedent for people being isolated who aren't ill.
Correct.
Which is very dangerous, in my opinion, what they do. And they're perfectly healthy people. They're telling them to stay in their house. Yeah. It's disgusting, and it's completely unnecessary.
Yeah.
All right. Now, I've got a statement here from an A&E consultant from Surrey. It's anonymous, but this consultant agrees with us that the whole thing is a bit of a scam. He says, in my opinion, and that of many of my colleagues, there has been no COVID pandemic, certainly not in the Surrey region, and I have heard from other colleagues this picture is the same throughout the country. In the months from March to June inclusive, we would normally expect to see 100,000 outpatients, around 30,000 patients admitted to hospital, and perhaps 30,000 pass through A&E. This year, and these figures are almost impossible to get hold of, we are over 95% down on all those numbers. In effect, the hospital has been pretty much empty for that entire period. At the start, staff that questioned this were told that we were being used as redundant capacity, kept back for the deluge we were told would come. It never did come. And when staff began to question this, comments like, for the greater good and to protect the NHS came down from above. So there's someone right in the thick of it in the NHS who says the whole thing is a scam.
Yeah, and you know, my wife worked in paediatric intensive care, and she said that in the winter months they would quite often get overflowing wards and beds, you know, in their hospital, which was in Nottingham. So just because we got that doesn't mean to say there's a pandemic. It can just as equally well mean that there is a slightly worse than usual seasonal illness.
And speaking about the NHS, I think the NHS has been used as a political football or a psychological football, in that the NHS is something that no one's allowed to question the existence of it. It's something that we need to protect. It's something which is sacred. And you were saying that this mindset centred around the NHS is nothing different from a cult.
Not really. I mean, clapping, you've got to go out and clap them. This was done earlier in the year, but eventually they stopped that. Why did it stop? Why isn't it still continuing? Surely we're still in this pandemic, so we should still be clapping the NHS, connecting the two things. But I think obviously they realised that they couldn't, people were going to start questioning this after a while. But the fact that they were suggesting how regularly you should do it and all this carry on, it's crazy.
Exactly. They're telling you to stay isolated in your own house, but then they're telling everyone to come out at the same time and clap your hands.
Yeah. So you're getting these contradictory advice for the sake of their narrative. That's all it is. It's it's got nothing to do with protecting public health.
What they're doing is, if you were going to attack whether there's a real situation, whether it's real or not, then you're seen as attacking the NHS. And the NHS is a sacred thing that you're not allowed to attack. You must be deranged if you're going to argue that we don't need an NHS or that the NHS is not of any value. So it's like this, it's a way of getting the herds following the same argument, I think.
It is. It's another thing which you shouldn't challenge, as you said. And if you do, you're clearly a bad person who should be chastised for doing so.
The NHS is only about goodness.
Yeah, of course.
Yeah.
And then we get this. We've talked about the language used, like key frontline workers has been used. Obviously, key workers is probably the main one, but there are frontline workers. That's been this military language tends to get peppered into the narrative in various places. And then just while we're on that subject, this idea of having the three things like stay home, protect the NHS, save lives. This three thing that is a psychological tactic. I think it's called omni trium perfectum or something, where you get the three things. Face, space, and whatever it is. I can't even remember them. I don't pay attention to them. And also something that was pointed out to me was the use of the yellow and black is associated with hazard, and they deliberately put that into the symbology.
Yeah. I've just mentioned a few other researchers that I have featured on my website. Dr. Tom O'Shea, he has a whole series of talks about this and other alleged viruses. He refers to this one as the newest boutique epidemic. He said, threat from coronavirus. Of the 500 strains, they're all benign in mammals except very rarely in the extremely immune suppressed. So he's going along there with the Béchamp argument that really, if you're a fit and healthy person, viruses have no effect on you, right? Stefan Lanka, we've mentioned him. David Crowe, I've got listed here. We've mentioned Dolores Cahill.
Yeah, David Crowe's work actually is very worthwhile. I did have a read of that, and he sadly passed very recently as well. He passed a couple of months ago, but he's got some very challenging research to the mainstream. Is very cogently argued. So check out the work of David Crowe if you can find it.
Now we'll just come on to this respiratory issue because people will claim that the COVID-19 does have different symptoms, more damaging symptoms than regular flu, which is difficulty in breathing. And apparently there's been people submitted to hospital that had to have special treatment. Have you looked into that at all, Andrew?
A little bit. I mean, the first report I became aware of, which at first I thought was disinformation, was a youngish New York doctor, and he said that they'd seen patients actually that were seen to be exhibiting symptoms of altitude sickness. That's what it looked like to him. The way that the lungs were, behaving, and the difficulties with the breathing that these patients were having was more like they were suffering from altitude sickness. And he said that they tried ventilating some of them, and that caused fatalities. And this was apparently this protocol came down from somewhere where they wouldn't normally have ventilated these patients, but they did. And this, of course, caused some concern that they didn't know what these symptoms were. Now, again, initially I thought this might have just been a made-up story, more fear-mongering, more scaring, more talk of people dying of lung diseases and stuff just to fan the flames of the fear, But it appears that this has happened in several cities around the world. And so we've got to ask ourselves as what was actually the cause of this illness, assuming it was real. Why did these people have these unusual symptoms? And then...
We'll just stress here that as a percentage of people who claim to have flu-like or corona-type symptoms, which could just be a regular flu, right, not necessarily caused by a virus, a tiny percentage exhibited respiratory symptoms.
Yeah, it was a very small number.
So are we convinced that it's the same disease?
We don't know. Yeah, we don't know if it's a different disease or whether they've been exposed to some environmental things in their area.
Dr. Tom Cowan and Sally Morell, in their book, they put forward the hypothesis that the respiratory symptoms have come from the switching on of 5G. That's very difficult to prove because you would need to look at the medical history of all of these patients.
So that's it. So it's easy to jump to conclusions about why somebody might have had this very severe lung condition. And yes, whilst it could be some mysterious illness, it could be something to do with 5G being switched on. We don't know. You need to see their medical records and whether, for example, they were a heavy smoker or whether they'd had some previous lung damage from some other disease or they worked in a coal mine or some industry where there was particulate matter in the atmosphere which was causing lung damage. All kinds of things that could cause these illnesses.
Yeah, but just because they've done a PCR test, that does not mean that their breathing problem was linked to an alleged SARS-CoV-2 virus, does it?
Not necessarily, no.
And we come on to the testing. You've done a video all about the PCR test, which we know now is completely unreliable. Even the government themselves admit that if you test a group of people with the PCR test and take all the ones that are definitely healthy, a percentage of them will show up positive for SARS-CoV-2, even though they're not. Now, I think it's something like 2.9% the government have stated. Many people say it's much higher than that. It's a much, much higher false positive rate. So if you've got that false positive rate, how the hell do you know that all of the results are not false positives?
Exactly.
They could all be false positives.
Exactly, and this idea of conflating the disease and the virus again. And we talked earlier on about whether they've ever isolated this virus in reality. So if they haven't really isolated it, then this test, however it's designed, is testing for,
something a bit like.
It's testing for something. Yeah. It's testing for something, or some sequence of molecules or particular molecules that somebody may or may not have in their body. And so it's a bit like a lottery result, really. But even if you take it, there is this real virus. It has this sequence of RNA in it, and this test is effective at detecting that. Then the problem is that having the virus or signature of the virus doesn't prove that you're going to be ill. It doesn't prove you're going to die, and it doesn't prove that you're going to be a risk to somebody else. And that's exactly what the creator of this test said, Kary Mullis. He says that it doesn't prove that what you had is going to hurt you or it's going to make you sick or anything like that. It also doesn't tell you whether you've got a lot of this infectious agent in you or a small amount. It just says whether there is some. It doesn't tell you how much. It's a qualitative test, not a quantitative test. And this has all been well established and well known. So this 0.7% or 2.3% false positive rate, again, that itself is pretty meaningless, because what's it testing for? It's not testing for what they claim it is. So to lock down whole areas of the country based on statistics which are derived from this test, and as you were pointing out earlier, it's like 100 quid a test or something, or whatever it is, even if it's 20 quid a test, And then, for example, what really irks me is that, so they've got this test now and they're using it. For example, they did all this testing in Liverpool, didn't they? And they got people to queue up to have this test, and I think they tested, the last figure I saw was when I had to have the nauseating experience of clicking onto the BBC website. It said they tested 23,000 people, And even with that, even if you take the virus's story as real and everything, and the test has been accurate, they only got 154 people tested positive. Not that were sick, not that were going in the hospital and then gone to hospital and died. 154 people out of 23,000, according to this test, which is meant to be their best way of detecting the presence of this virus. 154 out of 23,000 is not a pandemic.
No.
As soon as they got that result, they should have taken down all the signs in Liverpool, everywhere. They should have said, there is no pandemic, get rid of it all. But they didn't, of course, because it's got nothing to do with it being a pandemic. The pandemic story is just the cover version of whatever it is they want to do.
Yeah, I'll just read this from the CDC, the Centers
Yep.
for Disease Control website. If you test positive, a positive test result shows you might have antibodies from an infection with the virus that causes COVID-19. However, there is a chance a positive result means that you have antibodies from an infection with a virus from the same family of viruses called coronaviruses, such as the one that causes the common cold.
Yep.
So they've admitted that the PCR test can produce a positive result if you've got the common cold.
That's right. I mean, I think we mentioned before, again, I can't remember if we've covered this already, but it's worth briefly mentioning again. Andrew Kaufman, he looked at the Pasteur Institute's PCR testing protocol, and part of that is based on a gene sequence which is also found in human chromosome 8. So if you've got some degraded cell material that's partly broken down and they happen to sample that with a swab, there is a chance that that would give you a false positive from your own DNA, essentially.
All right then. So
the other thing with the PCR test, again, we've had instances, I've got it's in your notes here, that there was a chap called Luke Pompey, and he put quite an interesting post on Facebook where what he did is he got one of the tests and he opened it up, dipped the swab straight in the tube, and then sealed up the tube. He didn't sample anything, he didn't sample water, he didn't sample anything, he just sent the tube back, and his test came back positive, having not sampled anything but the air, So how reliable is that? There are many ways now to show that this test is not fit for purpose at all.